Happy and Healthy, a series to help you learn about available resources.
Welcome to an edition of a new series called Happy and Healthy, which is aimed at helping our older adults or seniors with a variety of issues that they face as we age. I'm one of those. Today we're going to be talking about safe at home. That's the theme of this particular program. And with us, joining us today, are Sandy Liberatore, who's the Director of Community and Strategic Partnerships at Seniors in Service of Tampa Bay. Welcome, Sandy. I'm so glad you could be with us today. We're here with Brenda Ruehl, Executive Director of Reliance, Inc. Welcome. Glad you're here.
Thank you.
And also joining us is Maria Avalos, the Health Educator at West Coast Area Agency on Aging. I want to thank all of you for coming and talking to our viewers about the services that you all provide. I'm going to start with you, Brenda. If you would tell us something about Reliance, Inc., your history and mission and so forth.
Reliance Center for Independent Living is the federally designated Center for Independent Living. It began in 1978. The mission of Reliance is to enable people with disabilities, of which a large number of people that we serve are elderly or seniors, to either remain independent or regain their independence so that they can live in their homes in the community rather than needing to live in long-term care such as a nursing home or other type of institutional setting. We provide a broad array of services, always with the vein that the consumer is the person who decides what they need and how they need to get it, and we assist in leveraging benefits and finances and accessing services, both private and public.
About your services too in a minute, Sandy. Tell us about Seniors in Service.
Seniors in Service has been in business for 27 years. We actually are intergenerational. We work with children who are struggling in school, as well as help maintain elderly staying in their homes and the disabled as well. So it's kind of twofold. It works from one end of the spectrum to the other. That opportunity comes into play with the volunteers that we actually work with to help those people. Are seniors.
I want to hear more about your recent press with your foster grandparent program. Maria, tell us what you do or what happens over at West Coast Area Agency on Aging.
Thank you. The West Central Florida Area Agency on Aging, we're a nonprofit agency. People don't know there's actually over 650 area agencies on aging in the country and 11 in Florida. So we cover a 5-county region. And our goal is to give seniors the information, the tool, and resources to help them age in place, in their homes, to help them make informed decisions and age with dignity.
Okay. I'm going to go back to you, Brenda, and ask you to spell out more about your services and what viewers could avail themselves of.
Okay. Well, Reliance, we are known as a cross-disability agency, which means that we serve all disabilities. And the disability is one that a person could be born with or in the area of working with seniors, something they acquire through an accident or illness or just the aging process. So we serve all ages, all disabilities. We do serve, we're a last resort agency, so we serve the poorest of the poor. One of the key things we do is make sure that individuals requesting services are utilizing all their benefits and resources in other ways. Are they tapping into entitlement benefits? Do they have some health care coverage that will cover something they're asking us
You
for.
don't have to be poor though, right?
You don't have to be poor. And the face of the poor looks very different today than it did a couple of years ago. We do serve people, and they're not necessarily poor. They just need help in leveraging their resources or finding a way to get what they need. Accessing the wide array of services in a community can be very difficult for a person, especially if you add in an aging person or person with a disability. We work with a consumer one-on-one, and they develop an independent living plan. We provide barrier removal, whether it's a ramp, roll-in shower, widening of a door. We do that through grants from the city and the county. We help people get equipment repaired, such as their power chairs and power scooters.
Are those things not covered? Is that
They're not covered.
by Medicare or other insurers?
Medicare and Medicaid and private coverage will oftentimes pay for the initial purchase. It takes a very long time. Medicare and Medicaid can take up to a year. We have loaners during that process. Also, it's very difficult to get them to pay for new batteries or new tires for the chairs. So we actually budget and raise funds to cover that, because a power chair without a battery or tires doesn't do you a lot of good. We also work with individuals to, particularly if they're newly disabled, and learning to live with that disability, whether they need to rearrange their environment in their home, tap into community services. What do they need to remain as independent as they can? We serve a large population of people who are deaf with relatively inexpensive equipment, such as doorbell flashers, telephones, and sonic boom alarm clocks. Again, about a $50 piece of equipment.
What is a sonic boom alarm clock?
Well, it
sounds
makes
almost dangerous to me.
Well, it is if your hearing is good. If your hearing is good, it's going to really wake you up. If you're deaf, we add a bed shaker to it. So when your alarm goes off, your bed shakes and it wakes you up. Because if you're deaf, you don't hear your alarm clock. So you won't know it's time to get up. You won't know it's time to go to work or go to school.
How do you add a bed shaker?
You literally just stick it on the bed, usually between the mattress and the box spring, and it really shakes, or it can be added to the frame. We do a lot. Last year we served about 110 people who are deaf with equipment services. About 50% of the people we serve are over the age of 59. So about 50% of our consumers are seniors. One of our new programs this year is our nursing home transition program. And unfortunately, because Florida doesn't have money follows the person money, you have to be eligible for Medicaid. But it enables us to assist people who are living in nursing homes who don't need nursing care to return to their home environment.
Moving them out of the nursing.
Moving them out of
the transition
environment.
Isn't going in, it's coming out.
No, we like for people to live in their community and be contributing citizens, and we all stay healthier the longer we can stay in our homes.
Brenda, it does happen that if you have a particular illness or injury that you might be placed in a nursing home for a period of time, right?
Absolutely. And you may need to be there for a short period of time.
Knee replacements, these kinds of things where they will, I guess, Medicaid, Medicare, or other insurers will pay for you to leave the hospital, go into a nursing home to get rehabilitation.
Right,
correct?
and then we often work with the person in the nursing home, their family, the discharge coordinator, to make sure they have what they need to return home. We also have 50% of our staff, actually about 80% of our staff, have a significant disability, so there's a lot of peer mentoring that they can do with the individual. And for newly...
Your staff?
Yes, and our board.
Have disabilities.
Yes, we have to have 51%. And we have about 80.
They have a better understanding of what can happen.
Yes, they've walked the walk, and so they understand what it is like for a person who's been in a nursing home and they've done their rehab and now they're ready to come back home. We also provide some support for the family, for the caregivers, so that they can connect with other people in similar situations. So every case is individualized. It's what that person needs to remain in their home and be healthy and safe and happy, and to continue to make the choices in their lives.
That's fantastic. Sandy, tell me more about the services that you provide, including this great press you got just the other day, Group Deploys AIDS for Military's Children,
Yeah, we're
right?
excited about that. That was great.
Yeah.
Well, you know, actually we mirror some of the same conversation here. We have that same opportunity of trying to maintain people in their homes. And I think everyone given that opportunity would prefer to stay in their home instead of having to go somewhere else. And to do that, we utilize volunteers. And our volunteers are going into the homes of the senior person and helping them stay there, or possibly the person who's disabled. And that person who can be of any age. It doesn't have to be a senior to be actually for us to serve them and help them. So it gives us an opportunity to have an impact on that generation and that group of people who really, given any opportunity to stay within their community, would prefer to do so. And I think that for all of us is really what we all would want. That group becomes friends. They become buddies. You know, it's amazing to see a senior going into another senior's home and what transpires. And in doing that, what we do is we might do lighthouse working, lighthouse work. We may prepare some meals. We may do some shopping with them or for them.
So it's other seniors helping the seniors.
Exactly.
Right?
Exactly.
Generally, okay.
They have to be, the volunteers have to be over 55. And the people that we serve are, most of our population that we serve is seniors. So
yours is better than 50%.
Yes.
Where yours is 50% in Self-Reliance.
Yeah, we're up there. The difference in our programs are the ones that are the children through the foster grandparent program, which is what you were talking about in the article.
Right. And so the people you serve, or the people that are volunteers, get to know each other because do you have meetings or?
Well, we have
social
training.
Something?
Well, not really. And as far as the seniors themselves, we give that opportunity to someone who has retired or has some time on their hands who wants to actually get involved in their community. And we give them that opportunity to do that by volunteering. So those volunteers are going out into the community and helping people, helping the needs of the community. And by the senior companion program, or the senior who goes in to help another person who's a senior or a disabled person, those opportunities come into play. You're seeing that person on a regular basis. You develop a friendship. You develop a relationship with their family. You develop a relationship, with the whole community there. So, for example, there's many of them that go into some of these high-rise apartment buildings, that the seniors are living in. And that whole thing becomes part of their social setting. They think of these people, the volunteers think of the people as part of their family, and the people who are being served they feel the same way about the volunteer.
Is yours income-based like Self-Reliance's, or no?
Yes. Yeah, the people that we serve is income-based.
So they have to be Medicaid eligible as well?
Not necessarily.
Or
it can be needs-based in that situation. So the income base comes into play with, if they're falling into our senior companion program, the funds require that those people fit a certain criteria as far as their income is concerned. So the volunteers have to fit some of that. But we have volunteers that also work in other programs that have nothing to do with this. But we do have volunteers that fit into the low income. So we give that volunteer an opportunity, has a low income, to have a small stipend that also enhances their possibilities of bringing some money in for themselves.
So they get some kind of, you don't call it a salary, it's a stipend.
Yeah.
So what would that range or be? So,
like $2.
For viewers who are listening to this might be interested in that.
Yeah, about $2.65 an hour. And we also pay mileage. And that gives, for some people, that's a tremendous help. Particularly in this economy, that does incredible things.
Well, if you can't get a job and you
Exactly.
do like people and you want to go out and do that, I want you to talk about the foster grandparent program some more, but I don't want to leave Maria out. So I'll get back to you, and I really want to talk to you about advocacy and what Self-Reliance does for that, but let's talk to Maria. So tell us more about some of the services. Are you a conglomeration of other agencies, or does your agency actually provide services directly?
Well, that's a great question. We actually do both. We provide funding to other agencies, for example, Hillsborough County Aging Services. We provide a lot of funding for home delivered meals and for the meals they serve at congregate dining centers. We also provide funding for agencies that do homemaker services, respite care, etc., transportation
This is federally
services.
funded as well. Are all of you federally funded, your agencies?
We're federally and state.
Federally and state, and this is federally funded?
And state. We receive most of our funding from the Older Americans Act,
Okay.
and that funding is channeled through the Florida Department of Elder Affairs. We also rely a lot on the generosity of our sponsors and donations as well.
Your sponsors are some insurance agencies and so forth, or not really?
Yeah,
Drug companies? Just
a
wondering.
lot of different sponsors. Off the top of my head, I think of Tampa General. We have some of the nursing homes that are sponsors. We have private companies that sponsors. We have anonymous people that make donations. We also do fundraisers, very similar to some other nonprofit agencies.
Okay, so you're providing funding perhaps to the two agencies that Brenda and Sandy represent, right?
Yes, we provide funding to different agencies that provide services directly to seniors, but also in our agency, we also provide a variety of services to seniors. One of our biggest programs is our Elder Helpline. So for example, somebody that's watching right now, if they're at home and they need to access X service and they don't know how to go about it, it can be very time-consuming and confusing to navigate the system. They can call our Elder Helpline, and then we can give them information and refer them to other services such as the ones that we're discussing today. What I do in my department, the Health and Wellness Unit, we provide health education and promotion program to seniors to help them age in place, be healthy, be happy, be independent, and make really healthy decisions so we can live a long, happy, and independent life.
Do they come to your facility for these trainings, or do you go out to individuals' homes? Or
I like to say I go anywhere and everywhere where I can find seniors. We do programs at senior centers, we do programs at churches, at libraries, we've done programs at hospitals, doctors' offices, mobile home parks, did I say libraries, churches, community centers. We go anywhere that we can find a group of seniors to help. We do a lot of programs at residential facilities, for example, independent living facilities, HUD housing, and all these great locations.
HUD housing as well?
Yes.
So, and are the people, well, if you're doing them at a nursing home, it doesn't really matter what the income level is of somebody who attends, or a library, or anywhere else, right? So you're the least income-based?
We don't have income requirements, that's correct. However, we do try to serve those with the highest needs. So we try to help serve people that are maybe at risk for falls. So we try to look at people that really have a high need for the services, whether they're frail, elderly, or whether they need information about access to care. So we go off needs.
I think all of you, one of the goals of Tampa Bay Community Network is to make sure our community has information that it needs to be the catalyst for disseminating information. And I think one of the most difficult things for most nonprofits and government agencies as well is that they don't have enough PR people to go out, and they don't have an advertising budget. And I think the taxpayer would frown on that. And yet, I think the taxpayer should pay for that, because they don't know what's cooking, you know? They have no idea. I've run into countless people since I've been with this program. I'm just a resource nut. But I see so many people who haven't got the capability to Google it, or don't understand that they can find these services, and they just don't know that they're available. And that's what we kind of want to do with this show, and try to help your agencies all get the word out better, because we all don't know what you all do. I mean, I'm sitting here and I don't know specifically what each one of you do, and I'm learning it just like our viewers are. I know that on your website, I saw, Brenda, that you do some advocacy for legislation, I guess, or something like that for handicapped.
Actually, we belong to an association, the Florida Association for Independent Living Centers, and the executive director of that association is a registered lobbyist. So she can actually go into Tallahassee and politicians and lobby. We do individual advocacy where if you needed a service that you were being denied but you were entitled to, we would do two things. We would help advocate for you, but most importantly, we would teach you how to advocate for yourself. And oftentimes that we have a group of, it's called Grassroots, and it's a group of people who come together once a month and they have fun. I mean, it's a social group, but more importantly, it's a group of people who identify local issues that they need to address through advocacy. For example, if a sidewalk isn't accessible to people in wheelchairs, we've done quite a lot of that.
That would be the name of the game in Tampa.
Well, we're very busy, yes.
I mean,
yes, we're
well,
very
I don't
busy.
have a sidewalk. Do all of you? I mean, I'm not sure.
And if there is a sidewalk, oftentimes there's no curb cut or it's not the right curb cut. We've done a lot of advocacy with the bus stops to make sure that the bus stops are actually accessible for people.
We have these wide
chairs.
roads in some cases, wide avenues, like, you know, a Fowler or a Bush, you know, our main.
Where you have 12 seconds to get across.
Well, how do you get across those things? I mean, and how far away do you have to go to get across?
Yeah, certainly the sidewalks and the roads and the streets are always an issue, and both our consumers and our staff sit on different committees and go to different public hearings so that we can have input on a broader spectrum. Right now, a big issue is managed care. If Medicaid moves into managed care and how that will impact seniors and people with disabilities on Medicaid. So we're very active in that arena and trying to ensure that the people we serve and the people of our community really have good access to the appropriate health care. And even though we do serve the poorest of the poor, we have lots of programs that anybody can take advantage of. We get into qualifying people when we have a grant, such as Seniors in Service has, where the funder says you can only serve people of such an income. But so many of our programs, we do a lot of outreach. We can't really, we have to be very careful about how we advocate. So we do a lot of outreach. We don't have a PR person. So we do outreach to individuals and also to communities. And these particular three agencies really have worked fairly close together, but in the last 18 months, we've really begun to work together so that we can make sure we leverage all the resources for the individual and for our community, which is really important. We were forced to kind of get closer together because of loss of funding, but also we can better serve a person because she may have something. She may have A for a person, but I have B. They have senior companions, which we don't have, but I've got a whole supply of equipment. So if they run into somebody that needs a walker or they need to borrow a wheelchair or whatever it is they need, then they call here. We work very closely with the Area Agency on Aging in regards to their resource center, and they help a lot of our consumers figure out how to access what they need. How do you compare this coverage plan to this coverage plan? And they have a food stamp program that they help people apply for food stamps to ensure that they have their nutritional needs met. So we all serve different groups of people.
You just said this about equipment, and it made me wonder, do people contribute or donate equipment to you once they don't need them, or if someone's passed on? Or
oh, absolutely.
How do you get the equipment?
Absolutely. It seems to be word of mouth. All of our power scooters and power chairs are donated from individuals, and then we repair them and recycle them out to someone else. Walkers, wheelchairs, crutches, white canes. People just find their way to us, and they're very generous, and they donate, and that really helps us spread our equipment money farther. Because if we have a used piece of equipment that we can recycle out, then we don't have to spend money. The other thing is it gives us an inventory for having it right away. So if you call me tomorrow and say, I need a portable ramp, if I've got one in my loaner closet, I can get it out to you. Where if I have to purchase one, it's probably going to take 10 to 20 days to purchase it and have the vendor get it.
So if something happened to somebody and it was just like this, they had no knowledge of having an injury or some kind of surgery that they needed, and they now need a ramp, they could call you and
Right.
get it.
And oftentimes that's the last thing you think of when you're suddenly in the hospital and you've dealt with whatever the crisis was, and then 2 days before time to go home, someone says, well, you know, if she's in a wheelchair, now you're going to need a ramp. That's not the first thing. It should have come to mind of the discharge planner, but it doesn't always happen. So we get a lot of those calls.
Having been disabled for a period of time with a major car accident, I certainly, when they said, okay, you're going to go home, I thought I would be all well, which was pretty dumb because it took about 10 more months. And everything was out of sync for me. So even as I tried to get back into the work world, I parked in the wrong places. I didn't know how to get in to a disabled space or anything, so I couldn't hold the door open because the garage had the spaces on a slant. I didn't know I might need a sticker, you know, that would allow me to park where it was flat. I think people just don't know what they need to know. I mean, we were all like that. What, you know, I don't know what I don't know. And so the fact is, getting the word out that I know there's discharge people at hospitals, but do they make it around to everybody? Because I'm very aware of friends who didn't know, and I'd say, wait, you just had that surgery. Are they sending you home with someone who is going to take care of you, or what are you going to do? You know, that kind of thing. And they didn't know, and these were major hospitals. I'm not sure they get around to everybody.
Well, most of the hospitals know about us and they call. We try to encourage them to call sooner than 4 o'clock on Fridays because it's hard. We get calls. I got one yesterday. I need a ramp. Okay, by when? Friday. They need a built ramp by Friday. And well,
they can't use a portable.
No, and that's not going to happen. And the person has been was in the hospital and in rehab. It's been a 6-month project. Wow. For them. But you don't necessarily think of that. I once had a person who was newly disabled that said, I feel like somebody dropped me into somebody else's life and they didn't tell me I was going. Because like you said, it's a whole new world. You just don't know. And you don't know.
And somebody says, we're gonna release you on Friday. You think, oh, I'm gonna be all better on Friday. I won't need anything. I'll be just all well, and that doesn't happen. We're gonna take a short break and come back and talk more about your program, so our viewers will be so knowledgeable about everything that's out there, and they can tell their friends and spread the word around the community. Stay tuned. We'll be right back.
Patty, let me be honest with you. Won't filing for Social Security benefits online be confusing?
George, it's simple and easy, and you can do it in your pajamas from the comfort of your own home.
Oh, my.
You've navigated through asteroid belts, right?
Oh, sure, plenty of times.
Well, compared to that, navigating socialsecurity.gov is a snap.
Really?
It's so easy. Even Kirk could do it.
Getting health information is a nightmare.
It's all in how you look at it. To you, it's a pile of books and reading until your eyes drop out. But to me, I go straight to NIHseniorhealth.gov, click on what I want, and boom, there it is.
NIHseniorhealth.gov, the medical website created with older adults in mind by the National Institutes of Health.
Getting health information at our age is tough.
Yeah, it's all how you look at it. To you, it's a pile of books and reading till your eyes drop out. But me, I go to NIHseniorhealth.gov, click on what I want, and bingo, there it is.
Well, thanks for the tip.
NIHseniorhealth.gov. It's easy to use. You can make the text bigger, make the contrast better, even make it talk to you. If only everything else out there were senior friendly. NIHseniorhealth.gov, built with you in mind.
Patty, I boldly went to socialsecurity.gov, and it's out of this world.
Socialsecurity.gov is a website for everybody.
Even teenagers?
Absolutely. Young people can help their grandparents with retiring online or getting extra help with their Medicare prescription drug costs.
So really, everyone.
Here you go.
Welcome back to our series, Happy and Healthy. We're talking today about safe at home, and with us is Sandy Liberatore, who's the Director of Community and Strategic Partnerships at Seniors in Service of Tampa, and Brenda Ruehl, Executive Director of Self-Reliance, Inc. Also Maria Avalos, who's the Health Education Person at the West Central Area Agency on Aging. Such a long title.
Yes, it takes a lot of practice.
Yeah, I was going to say,
Mouthful.
that's almost the whole entire elevator speech that they tell you to have. Hello, West Central.
Florida.
It's just a lot. Why do we need area? I mean, everybody loves an editor. Everybody needs an editor, and I want to edit that. I can't help myself. Okay, so I want to go back for a minute. I want to talk about safe at home. Exactly, but before I do that, I love this foster grandparent program, having become a grandparent myself 4 years ago, and now have 3 grandchildren, which is just fabulous. I don't think there's anything better than being a grandparent, and I wish we could have skipped the middle.
Yeah, I think most people could.
Because
feel
that's
that
a
way at
lot
some
of work.
point.
That whole parenting thing's a lot of work. But that grandparenting thing is just the most delightful thing anybody could do. And if they don't have them around them, you know, if like one of my grandchildren lives in D.C., but my other 2 are here in Tampa, so I get to horse around with them more frequently. But if you don't have them around, you're missing something fantastic, I think.
Yeah, I agree with you, and I think our foster grandparents who are our volunteers that are helping the children feel the same way. It's totally heartwarming, as you well know.
So tell me how this works, being a foster grandparent. You get training, or?
Oh, yes. So actually all our volunteers.
You get training in being as silly and
Not necessarily
all the
that
things we
aspect.
are with our grandchildren. Hello, you have to be silly now.
There is some appropriate behavior that goes along with being a foster grandparent as well. In this day and age, we have to be very concerned about, you know, the things that we do and the way things are handled. Yes, we actually, all of our volunteers have to go through a program that actually has them, we have level 2 background checks on everyone. We train them to actually fit the certain need that they're going into, whether it's the senior companion or the volunteer foster grandparent. It's one of, you know, it's all directly connected. They actually go through all of that before they ever get into someone's home or go into someone's classroom. So they're prepared.
How are the children selected? Or
actually, the schools do that, or the other agencies that we partner with. Generally, they are children who are struggling. Our volunteer foster grandparents are going in there and they're working with young people who are not possibly up to par to where they should be with their peers, and they're helping them. The classrooms, as you well know, have so many activities going on, and there's so much requirement for the teachers that a foster grandparent going into that classroom makes a tremendous difference to the teacher as well as the student who's struggling.
So it generally takes place in the classroom,
yes.
the foster grandparent program?
Most all of our situations are in that capacity, other than the ones that are, we have after-school programs that we get involved in, we have before-school programs that we're involved in. We're even looking at some other initiatives that would have us in a different arena altogether.
Does it ever happen that the, just wondering about this, that the foster grandparent picks out a child they really like, and can they invite them to their home, or no? That's a no-no?
No, that's a no-no.
Everything has to happen
yeah, we want the safety of the child, you know, and that's very, very important. We want the volunteer to enjoy it, and we want the safety of the child, and the best way to do that is in a supervised situation.
Okay. So do you have to be a certain age to be in that program?
55.
55 or older?
55 or older. And we have, we actually have people, I mean, it's funny that you should, you know, bring up your own family, because a lot of the volunteers get involved for that same reason. They had their own children. They now have a little bit of time. Some of their grandparents aren't, I mean, their grandchildren aren't here. So as a grandparent, they want to be involved. And it's a great way to do it. And it gives them that opportunity to, you know, have hands-on kind of situation with a child.
And how lucky I think those grandchildren would be, because you have somebody who's been experienced in raising a child come in, not just maybe a guidance counselor who's young and didn't do that yet or whatever, and with people having children so much later, they may not have exposure as much to someone with experience and a little bit more patience than we probably had the first time around. I'm not so sure. Let's talk about this safe at home, how the dangers and what can be done about them. You mentioned some things with regard to a bathroom, and I'm remembering when my mom lived with me, that I immediately went and had the bars put in the shower and all of that, and then was told about area rugs, get them. So can we, and that was costly, by the way. I had no idea that these, I guess I looked up somebody commercial or something, and they were advertised like that. They do the bars. And that was, I thought, you know, once I saw it, I thought, that's really probably not worth that much, you know? Is that some service that somebody provides here, or?
Well, I provide a lot of education on falls prevention. And when we learned the topic of this series, Safe at Home, that's the first thing that came to my mind is, well,
falling?
The first thing we can do is make people's homes safer so we can prevent falls.
Okay.
So it's a lot of education we do. And the biggest thing that people can do is utilize a home safety checklist. The CDC has great checklists available. We have some checklists that we cover during some of our falls prevention programs, where they can go around each room of the house and really see what are some of those hazards that are available. I mean, looking at this room around us, and there's probably 5 hazards that I can point out. And if I go visit one of our seniors at home, I know there's a lot of hazards that we can eliminate. Some of the hazards may be costly to eliminate, but some are very simple, such as throw rugs that you mentioned, proper lighting, installing night lights, having phones where they're accessible. Some of the other repairs that you're mentioning, grab bars, are very important. And I do have people say a lot of times that, you know, maybe they don't have the financial abilities to invest in this strategies, safety strategies, but I remind them how costly falls are. You know, the cost of an average fall is about $19,000. And if somebody's,
oh my goodness.
If we're looking at hip fractures, we're talking $36,000 to $40,000. So I think, you know, it's better to invest maybe a few $100s up front and save the other $19,000 that a fall could cost us. And I know our agencies, one of our biggest goals and our mission is to help people age at home. You know, people that suffer from hip fractures, 50% of them are not able to return home or live independently after such a severe injury. So falls are a really big crisis that we're trying to address.
We do pay for grab bars.
Wonderful.
Oh, nice.
And we have negotiated a decent price with a vendor of ours who will go in and do the assessment. And we give them a good idea of what grab bars they need, because sometimes people need them outside of their bathrooms for other reasons. So we do have funds for the installation of grab bars, and the money that we get from the county and city are strictly for barrier removal. We do a lot of grab bars. One of the things that are...
Is that the most common place to take a fall, in a bathroom, because of wet, and, or is there...
Bathroom and kitchen, I believe.
Oh, really?
Bathroom is the most common, and I always mention that it's one of the most dangerous rooms because if you look at it, it's so small, so you have a lot of obstacles to climb over. And it's also, all the surfaces are really hard in the bathroom. So if you fall in your bedroom, you may be cushioned by a rug, or, you know, have carpet. Or in the bathroom, you have a toilet that you can injure yourself on, the bathtub, the tile floor. So it's a room that we really should spend a lot of time making sure it's safe.
One of the things our staff is very good at, and we're constantly training and retraining and reminding, is on the assessment of a person's environment. And this is particularly of concern when the person's newly disabled, or they have come back from being in the hospital for a disease. Is, you know, like she said, what does that environment look like? You know, get rid of those throw rugs. If you're in a chair or a walker, you got to arrange that furniture so it doesn't become a barrier, but it also doesn't become something that's going to cause you harm. you know, if you've got the wrong kind of leg on that chair and that walker catches it, you're going over with your walker. So we really look at the environment. We always look at the most achievable and cost-effective way to create a safe environment. So I always tell, you know, people, we're not Cadillacs, we're Saturns. So you're not going to get, you can go to the store and you can get lots of pretty things, but you're going to get the basic, you're going to get your needs met, and you're going to be safe in your home, but it's not always going to be pretty. So in our barrier removal grants, you get basic white tile. You don't get the Italian marble, and no, we can't match it, which is sometimes difficult because people have nice houses, but now they're older and they, you know, don't have as much money, and lots of times don't have any money, and yet they need to be able to take a shower or use the toilet. So the environment is very, very important, and then we figure out how to remove those barriers. And some are really easy and cost-effective to do, and a lot of it's just training the person. Don't put that, you know, their kids come in on the weekends and buy them pretty little rugs, and we're like, get rid of it. You know, your mom's gonna fall.
I've started thinking about the spaces between, say, a coffee table and the couch, and is that wide enough to accommodate the walker? I know I ran into several things with my mom as she started losing some of her mobility, and that was very difficult to try to figure all that out, and nobody came to assess it. So you actually want somebody will go from your place and actually make the assessment?
Absolutely.
Or all of you?
Yeah, we're not going to spend a penny, and I'm sure you guys are the same way. You're not going to spend money, especially since it's public dollars, but we need to see what we're paying, and we need to see what their needs are. You know, if they say they need a raised toilet seat, we want to really make sure that's what they really need, because if she's 4'2", she's not going to be able to use that raised toilet seat. She's going to be up to the ceiling. So we send our staff to a basic assessment, and they'll do a full assessment, social assessment, what does a person need, and then we have a vendor that we put through an order and say, could you please go out and assess, you know, what kind of grab bars do they need, because you need to make sure the grab bars can actually, the building can hold it, also what kind of toilet seat riser might they need. You need somebody with those kinds of technical expertise to be able to go in and make those decisions.
And some of this getting in and out of the tub, to me, that was a big one. And when I had the grab bars put in, I remember saying to my mom, you need to use my shower because that walk in and walk out, and she refused. I don't take showers, I take baths, and that's what I'm going to do, which was absolutely crazy when you could, at least she could get in there. What do you do about those kind of situations?
Well, we oftentimes, it's funny that you asked that question, because that's one of the biggest issues in our barrier removal program is people want us to do something for them, and they can't use the tub, you know, or they have Parkinson's, and you know that 6 months down the road they can't. So it's kind of what we call truth time, and the truth is this: you're going to need that walk-in, roll-in shower. We have public dollars available, and we can do that for you. But we can't do anything with your bathtub. And the grab bars really aren't going to work for you, because it becomes a safety issue, and also the fact that you need a walk-in, roll-in shower. 90% of the time, we're able to get them to understand the long-term needs they have, the safety needs. There's always the 10% of the time that you say, I'm really sorry, but we can't help you. If you want to spend your own money to do it, that's your business. But we aren't going to have an installation of a product or service that we know is going to be harmful and detrimental to the individual.
Yeah, it's usually easier coming from someone else besides a family member also. And I think that's why in the program staff it's much easier.
Extraordinarily hard on the person when you tell them you are going to get worse than you are today, and so we're having to plan for that. How do you tell somebody that? They don't want to hear that. My mother, as much as they don't want to hear, no, you can't drive anymore, you know, and you know, there's no way anybody wants to hear I can't. You're going to restrict my mobility? Are you kidding? So, I mean, how do you...
That's where the peer mentoring comes in, and we just see that so much in whatever field we're in, is where somebody else who's already been through that can say, they can really identify with those feelings. It's like sending in a staff person who's in a wheelchair talking to a kid just racked up their car and now they're in a wheelchair, because they know what it's like. And so that peer mentoring is really important. We also work closely with their healthcare providers, as in their doctors and their nurses. So if they hear it over and over again, and then finally
Then they will get prepared,
Right.
even though they.
Right,
really-
especially when
It's
you
not
have
an
the
easy
solution.
transition.
It isn't. Those are tough.
That has got to be more of a transition than I'm coming out of a nursing home going back to my house. I mean,
That's a huge transition, and sometimes it's difficult on staff because they want to do what needs to be done, but the person is resistive or reluctant, and so then they start second guessing themselves, and then you have to have somebody that says, this is what this person needs. This is what they have to have, and that it's our job to provide it.
We actually have it a little bit easier than this because the volunteer is a senior going into a senior environment. So, you know, as the two people communicate, they're both seniors. They may be at different levels, but they're both seniors. And
so it's
they've
not like a
had-
19-year-old just came in and told me what to do.
Exactly. It's kind of like your friend, your buddy, you know, somebody you feel secure with, that you feel
And
comfortable
then they
with.
can bring it up and they can say, having gone in and
Yep.
doing this companionship,
Yep.
which I don't think you explained fully, but the companionship program that you have lets them go in, and then what does Seniors in Service do this, or do you then go to
No, we do
one
not.
of the other agencies?
We go to them.
Oh, I mean, for the supply, so what you need, like if you didn't, if your companion program found a need for the grab bars, for example, does Seniors in Service provide them too?
Oh, no, we'd be
You would be
looking
going,
for...
They'd call
that's
us.
what I was talking.
We
They're
call
gonna
them
go
all
to
the
you.
companions.
They're gonna go to you, right, that's what I was saying. And there's nobody else you can go to, is there?
Well, we refer people to a lot of community resources, but talking back about the decisions to adopt changes, I actually have somewhat of a different viewpoint. What we try to do with our programs is help people make their own decisions. We give them the information, the benefits of adopting those changes, whether it's a grab bar or, you know, the rolling chair. But I think when people own the decisions, they're going to be much more open to it, and they're going to be able to maintain those changes and really see them from a different light. But I certainly agree with the mentoring program. We have programs where, you know, there's small group programs for people that have chronic health conditions to learn how to live with those conditions and take control of their lives. And that's where they hear from somebody that's gone through the same problems or the same issues, the same challenges, but they should really own those decisions and come up with solutions that work for them, because not the same solution may not work for everybody in this room.
And our consumers do that, but when they're asking us to provide the funding for a solution that's not a solution that's safe, we can't do that.
Yeah.
You know, that's the
They're
only
asking
difference.
you to do something in the middle.
Well,
For
they're
example, They
asking
don't want
us-
to go all the way, like
right,
tub
right.
business.
Or they don't want to, you know, they want us to put a portable ramp on a front door with 4 steps.
Yeah.
Well, that's not happening. And they get angry. You know, I don't want that regular built ramp. Well, and that's why we prefer to use our vendors who go out and say, you can't put a portable ramp when you have 4 steps. You need to build a ramp. So that's the only, because to do anything else would be negligent.
Yeah.
Right.
So, I mean,
Now,
they decide.
you've all sort of pointed to the fall business, and that's why you need all of this. Are there other issues besides falling that are, I mean, I know getting around, just getting around, but are there other issues besides falling that you need to think about your safety?
Isolation is a big factor for us. You know, one of the things that you were talking about earlier is, you know, dealing with your mother. Picture that if you were working and she's at home by herself. And so many people are dealing with this today. And what happens is that senior ends up being the person who's kind of at home, feeling lost and alone, not sure what to do. And you talked about resources. You know, your viewers are getting an opportunity to hear some possible assistance here. But for some people, they're not coming in contact with that. They're not sure what to do, and they feel like nobody cares. For us, giving them a companion gives them that opportunity to have somebody to communicate with, somebody who they feel like cares, that they're there, somebody who can kind of direct a little bit what's going on with them, lift their spirits up, and take them to another place. That we
And take the edge off the
Exactly.
isolation feeling
Yeah.
that you're
Yeah.
that you're having. So who does address, I know I did a show once with Meals on Wheels in which they told me that in addition to them coming, they find that they're very, very welcomed and that people want to talk to them for a few minutes, and they become sort of this pal of the other person. And I think some of them even phone them to see how they're doing if they didn't answer the knock or whatever, things like that. Are there other situations like that that address this isolation, other programs that address this isolation, depression kind of thing?
Well, we always encourage people to take advantage of senior centers. YMCAs have programs for seniors. I think the mentorship, the grandparent program would be a great opportunity. When we come to residential facilities, we find that they really make families and they bond with each other. So they help each other overcome a lot of this isolation. So really encouraging them to use the resources that are out there. Sometimes it's hard to make that first step. But
I think a lot of people don't know about transportation. You must fund that. You two probably don't do anything with transportation, do you?
We don't fund it, but that's one of the key questions that we ask.
Yeah, how do you get to the doctor? How do I get to the mall? I can't drive anymore, blah, blah. What happens there?
Well, you try to put them into the resources where if they can use a regular bus or if there's a medical transportation, if it's a medical appointment. One of the key things that we always say, we try to identify is the natural supports. Who's your family? Who's your friends? Who's your neighbors? And also one of the key areas is, they go to church. So many people go to church, but then suddenly they get sick or they're too elderly and they're not going to church. So we help them reach out to those church members because almost every church has somebody that will give you a ride to church.
Or has a bus.
Or has a bus. There's all kinds of ways.
Our county, though, provides some kind of service, does it not?
Well, there's some services, but...
Are they not good?
Well, I'm not saying they're not good. They're just not there. They're not always there for their medical appointments, and some of the senior citizen centers have trips that you can go to. But it's, sometimes at 11 o'clock on a Sunday morning to get to church, and we like people to use their natural supports.
I think you may
be more comfortable with that, for sure.
I think you may be referring to the Sunshine Line, because I know I see them a lot at the residential
facilities. Isn't there a piece
facilities.
of Heartline, or is that not?
Heart Plus.
The Heart Plus.
Yeah.
Is that, and they'll take you to, say, a rehab center or a...
Well, they'll take you any place on their route, but you pay for it, and it can be expensive. I have a couple employees who rely on Heart Plus to get places. Sunshine is for medical.
There's nothing free for seniors to do any of that?
Most of the seniors have some kind of reduced fare, but there's, with the funding cuts in our country and on our local level, a lot of programs have been cut out completely, and when they haven't, there's been drastic cuts in what's available, which is why all of us try to spend time developing those natural supports and relying on volunteers.
I think this is where the Elder Helpline may come in, because a lot of times there are resources available, but somebody can spend all afternoon calling Heart Plus to see what their requirements are, what's the income, or how much is each fare going to cost, or call Sunshine. But if they just make one call to the Elder Helpline, we're going to be able to provide all this information and really refer them to the service
the right
that
agency
meets,
so they don't feel
that
frustrated
meets
as
their
they go
needs.
along.
Exactly.
Besides the isolation must be the tremendous frustration in that. And since I think our being such a mobile society as we have become in the last couple of decades is a killer. Because, I know when I was growing up, certainly we shared my grandmother. We brought her, everybody went, the grandchildren, the children, to visit with her or to take her to our house for this Sunday dinner or the next house or whatever. And we don't have that because we're not all, near each other. We have children who are, trying to make a better living in bigger cities or what have you. And it really does affect all of this. I bet we didn't have as much need for your agencies. Do you think?
Well, I think families were doing, like I say, lived closer and they were,
that's
doing
what
more.
I'm saying. We're so mobile.
Well, and we're living longer, so a lot of seniors.
That's the problem.
But a lot of seniors who were able to volunteer in the community and do lots of things now are still having to work. And oftentimes you have 3 families together and you have a senior person providing care for. We serve families where our consumer is, 70 and the elderly parents are in their 90s.
Oh, plus what about the reverse thing? I did a show with, about the number of elderly
Bringing up the grandparents.
bringing up their own grandchildren. And somewhere in the middle, their children are in jail or drug addicts or something. And you have, we have a huge population in this town, don't we?
We have a lot of single moms.
Huh?
We have a lot of single moms who are having to rely on their senior parents because they're working 2 and 3 jobs to be able to
So they're the
support their
caretaker
children.
during there, or they've moved back in with their mom.
Yep.
So that's a huge issue, isn't it? That wasn't there before, maybe.
And also the fact that a lot of seniors are females, and typically we're the caregivers and not the caretakers. So it's a whole different dynamic when we get older.
Because women live a little longer than men.
Right.
And I've always said, and jokingly, I must preface this, women live longer than men because they finally get a break. They don't have to cook for somebody, clean for somebody, and do anything. And they're like, okay, I think I'll live a few more years so I could just do stuff on my own without anybody telling me what to do,
But if
or
I can
having to answer to somebody.
If I can put a plug in for we call them the AAAs, the Area Agency on Aging, their elder helpline is really incredible, and especially now that they've actually become an Aging and Disability Resource Center, because they really do a great job at getting the information. They can follow up with people to make sure that they use the information. Because
Oh, that's
information
good.
is only good if you use it.
Is there anything you want to add very quickly, any of you?
There's a lot of resources that we offer that we didn't have time to cover, such as health and wellness programs. And so the best way to reach us would be to call the Elder Helpline again. People can also visit our website, www.agingflorida.com.
Agingflorida.com.
Correct.
Okay, and you are at?
www.self-reliance.org.
Okay.
And we are at www.seniorsinservice.org.
Thanks so much for all that you're doing for our seniors, our older adults. We appreciate your agencies and what you're doing. And I hope that the viewers picked up a lot of tips and you'll hear from them soon. And we'll see you next time on our new series called Happy and Healthy. Thank you for tuning in.
Getting health information is a nightmare.
It's all in how you look at it. To you, it's a pile of books and reading until your eyes drop out. But to me, I go straight to NIHseniorhealth.gov, click on what I want, and boom, there it is.
NIHseniorhealth.gov, the medical website created with older adults in mind by the National Institutes of Health.
Getting health information at our age is tough.
It's all how you look at it. To you, it's a pile of books and reading till your eyes drop out. But me, I go to NIHseniorhealth.gov, click on what I want, and bingo, there it is.
Well, thanks for the tip.
NIHseniorhealth.gov. It's easy to use. You can make the text bigger, make the contrast better, even make it talk to you. If only everything else out there were senior friendly. NIHseniorhealth.gov, built with you in mind.